All right, ladies and gentlemen, let's go over one of the biggest topics in nursing school. So I know pharmacology is really tough, especially when you get into pharmacology for psychiatric patients. So we're going to break down the pathophysiology first, and I'm going to show you guys exactly how to remember how these drugs work. Because honestly, you can study all day you want, but if you don't start with your pathophys, yeah, it's like you're wasting time studying. So let's get into our psychiatric medication here. So one of the first things you have to realize is that psychiatric medications really affect three major neurotransmitters in the body. So you have dopamine, norepinephrine, as well as serotonin. Now I broke all these down for you here, but really in your brain, you have dopamine and serotonin that act as a reward and a happiness hormone in the body. Now the book's going to tell you for dopamine inside the brain that, you should remember its reward, its pleasure, its motor function, its compulsion, and you're trying to remember all these. I want you guys to organize it in your mind as DOP, D to the O to the P. So determination, basically getting a reward and motivation. Obsession, so that's why your patients with cocaine habits, methamphetamine habits, and also drug habits, usually stimulant habits, have an obsession, and this is what gets them addicted. And you also have pleasure receptors, and this is your dopamine reward. So remember dope, termination, obsession, and pleasure, okay? Now the frontal cortex of your brain is most affected by dopamine as a neurotransmitter. Now we're going to get into dopamine in the rest of the body and how it's a catecholamine and how it increases your blood pressure and all this other stuff. But guys, dopamine in the brain is way different than dopamine in the rest of the body. And I'll explain that later, but really the basic concept is your brain has a filter, almost like a coffee filter. And your brain has what's called a blood-brain barrier, the BBB, okay? And really all the other stuff in the body cannot get directly into the brain without going through this blood-brain barrier first. Because if something really is toxic to your brain will shut down and your body shuts down. So your body has this kind of border patrol, if you will, or security to not allow everything into the brain. All right, guys, the next one is your serotonin. Serotonin is your happiness hormone. So I kind of remember this one as Siri from your iPhone. She makes you happy because you can ask her any question. Now, serotonin is in your book. They're going to say, remember mood, remember sleep, remember cognition, remember the memory. And you're trying to use serotonin to remember serotonin because you're using memory to remember this. But you know what? Forget the book. I want you guys to remember as SER, okay, for serotonin. And it's sleep, emotion, and also memory. You can also put remember, okay? So serotonin, remember, is that happy hormone that helps you sleep, helps you have emotion, and helps you to remember. Now inside the brain, it almost acts like a racetrack. It goes all over the brain here. But really it starts, and its really focal point is in the hippocampus. And I remember the hippocampus is your memory in your brain. And you can just kind of remember it as like a big hippo walking on your college campus. And this big hippo just has a bunch of knowledge about books. There's a hippo there. I don't even know if that looks like a hippo, but maybe we can draw like a mouth here. There we go. Maybe that's a hippo. All right. So just a big hippo getting all this big knowledge on campus. That's your memory and helps you to remember in your hippocampus. Next is your norepinephrine. And this primarily we see with our MAOI drugs, which we'll get into, as well as our atypical antidepressants. Okay? So, just if you guys are like, what are you talking about? Relax, we're just going over the patho. Okay? So, norepinephrine, also known as Levophed inside of pharmacology. Now, remember, guys, almost all pharmacology starts inside the body. What we do in medicine is we extract it, or we take a synthetic portion. We make it in the lab. And the synthetic portion, we have it in the lab and we just inject it into your body. Just like epinephrine, it's just fancy words for adrenaline. We take an adrenaline, or we've copied the molecular structure, put it into a bottle. That's why if you're dying, we're going to shoot you up with adrenaline, get your heart going again. So norepinephrine is in the same category or the same family as your epinephrine or your adrenaline. They even call it noradrenaline sometimes. And they call it this because it's known as your stress hormone, okay? And your stress hormone turns on your sympathetic nervous system, increases that heart rate, increases that blood pressure, that fight and flight, turns off your poop nervous system, or your PNS, peripheral nervous system, also known as your rest and digest. So no more gastric juices, no more digesting when your SNS is turned on. That's why with norepinephrine, a big thing with that is hypertension with our norepinephrine drugs. Especially our MAOI, we have a big, huge blood pressure alert. So, norepinephrine also controls your cognitive alertness. So, if someone is dying and we're going into shock, usually septic shock, or it can be other types of shock. Now, norepinephrine is one of the last line drugs we use. My instructors in nursing school told me that you use Levophed or you leave them dead. Because Levophed is one of the last line drugs to get that blood pressure up, to squeeze and vasopress all that blood back to the vital organs, which is known as your sympathetic nervous system. Heart, brain, lungs. Get all that oxygen, all that blood back to basically the most vital organs, the stuff that keeps you alive. So your norepinephrine helps with that cognitive alertness from your sympathetic nervous system. Your brain, heart, lungs, usually mostly your brain, okay? So with norepinephrine, you can remember NOR. No hesitation, on alert, and you can recall memory, okay? Now, norepinephrine acts peripherally as a vasopressor, or basically brings blood back into the brain, heart, okay? But the thing is that norepinephrine also is that neurotransmitter that helps in the brain, and you guys can remember these as NOR. So if you guys want to write that down, I'm going to expand this right now. And we're going to pretty much do a wrap-up, just a little bit more in detail. Here we go. Now, before we go on and before we get really specific with dopamine, norepinephrine, and serotonin, I want you guys to do something very important. Now, honestly, this is crucial to understanding your psychiatric medications. You need to get a note card and name them DOPE, SER, as well as NOR, okay? And what you need to do is copy my acronyms or my memory tricks here and put these on the front. This is going to be huge because when you get knee deep in, SSRIs, MAOIs, all your atypical antidepressants, and then you get into your bipolar medications, this is going to be your lifeline. So, let me scoot you up and you guys can pause the video and be able to copy that down. Then we'll go one by one and fill in the back of the card, and I'll show you guys how to do that. OMG, it's the psych course. That's right, ladies and gentlemen. We have created the first psychiatric course for simple nursing called Psychiatric 101. Now, psychiatric is kind of like OB and pediatrics, where it's not as tough as medical surgical nursing. And it's not, really nothing in nursing school is going to be as tough as med surg and pharmacology. So honestly, the biggest thing with psych is really two things. It's one, knowing how to answer the question. If you guys don't know how to answer psych questions, that's really the major way nursing students fail their tests. So I'm in the business of helping you pass. I'm also in the business of helping clear your understanding and crystallize it to make sure you understand and grasp things, okay? Now, the biggest thing about this psych course is I focus directly on the struggle points. Pretty much the reasons why nursing students fail. First one is because of the questions themselves. So I include NCLEX style test questions and I walk you through how to answer the test questions. Number two is I also include pharmacology, because really, pharm stinks. Pharm is really horrible, makes you want to quit nursing school. And we also include other very difficult topics in psychiatric. Now, everything is not included in terms of the minutia. I'm really focusing on the major reasons why nursing students fail. So if I can help you guys get over your toughest parts of psych, obviously you're still going to have to study and know your terms. It's not going to be as difficult as med surg or pharmacology. So that's why I'm breaking down the biggest issues here. So guys, follow along in the videos down below, and if you want a specific type of video request for a specific diagnosis that I didn't cover, go ahead and shoot me a video request by clicking up top on the video request or live webcam, and this is only for your annual and diamond members. So guys, let's do it, and let's kick some psychiatric boot.